Doctors of Reddit, what was the dumbest patient you've ever had? Why? I'm not a doctor, I work in the but a patient's complaint was that she had seasonal diabetes. Dude eats a smell off the ground for $10, gets sick, doesn't get seen for 4 days, ends up being sepsis, comes to the hospital in a wheelchair because he's paralyzed due to the infection. Had a little boy with very little intestine left after many surgeries had removed dead or non-functioning bowel, so he could not eat by mouth or stool out of his rectum. He was fed a high-calorie, highly nutritious formula through a tube in his stomach, which then went through for absorption, ending into his ileostomy bag. As you can imagine, it was very hard for his body to retain calories nor nutrients, so his growth and development were very behind. One day he is brought into the ED by mom because he is dumping too much liquid stool into his bag. He was brought in on a gurney, holding a bag of Cheetos and drinking Pepsi in a baby bottle. I don't have diabetes, I take medicine for that. Happens so often I can't put a face to that quote. I've told this story before, but I had a patient that got a pretty nasty infection and became septic after putting collard greens in her vagina for several days because she thought it would induce an abortion. Doc here. I had a guy with an ICD in place. For those who don't know, it basically shocks your heart if it goes into a funny rhythm. He would regularly come into the hospital to have it turned off because he would do a ton of cocaine and the thing would keep firing due to his high heart rate. I told him not to do cocaine. He kept doing cocaine. Female patient presented to the emergency department with severe vaginal pain. The patient informed the nurse she had wanted to get one of those IUDs, so she couldn't get pregnant, but couldn't afford it. So she did the next best thing. She put superglue into her vagina and tried to seal off her cervix. Oddly enough, it was causing significant irritation. Had a patient who was coming back post lap band for a checkup. What we usually do is revise the patient's weight, etc, and tighten the band or loosen it as needed. Now the thing to remember is that getting lap band isn't as easy as just throwing down some money. For 6 months, the patient must meet with a psychiatrist and a dietitian to understand what they are getting into and if they can adjust their lifestyles and commit. A goal weight loss target, X, lose 10 pounds, is usually set for the end of the 6 months to ensure the patient is serious. So after all of this rigorous evaluation, a patient is deemed fit for an operation. Enter my patient Sylvia. I checked her chart. BMI before surgery was 40. She was morbidly obese and now had come in for her first follow-up to ascertain if she'd lost any weight. Well, I put her on the scale, calculate, and what do I see? Her BMI was now 45. Perplexed, I asked her to explain her diet to me. Sylvia, well, I've been doing a liquid diet just like you all said. Me, very good. Can you maybe what you have? Sylvia, I make smoothies and have them whenever I feel hungry. Me, so what do you put in your smoothies? Sylvia, cake and ice cream. Me. Yup. She was serious. Somehow it didn't occur to her that this wouldn't be healthy. We reversed her band. TL. Doctor, patient on lap band gains weight having ice cream and cake shakes. An older lady was brought into the ED barely conscious by her husband. In a very thick Italian accent she told the doctor she was dying. She had complained of feeling tingly and having a dry mouth prior to passing out. The doctor sat the husband down and they did a history. No serious medical problems, and she was very fit. In fact, she spent the morning cleaning her son's bar, as she often did on a Sunday morning. Considering her age, they took these symptoms very seriously and begun running tests to find the source of her ailments. The son came in to visit his mother, and on the way he bypassed his bar. He noticed that his mother had helped herself to some of the treats prepared the night before. The son, the apple of his parents' eye, had to then explain to his father and the doctor that the treats she had enjoyed were space cakes. And apparently she really enjoyed them as she ate quite a few. They then had to sit down and tell this elderly lady that she was not dying and that she was in fact stoned. Fortunately she was still high enough to see the humor. TL. Doctor, elderly lady was convinced she was dying, but later found out she was just stoned. Oatmeal lady. Obligatory. I'm not a doctor. I used to work in a doctor's office. A woman comes in after having a baby and tells us she's having trouble breastfeeding. I book her an appointment at a breastfeeding clinic, give her some resources, etc. Her appointment was fine, and she went on her merry way. A few weeks later, we get the facts that she went to the breastfeeding clinic and everything was fine. Awesome. A year later she shows up for her doctor's appointment, and she's morbidly obese. She must have put 100 pounds on an already obese frame. She's developed many health problems related to her weight that she refuses to acknowledge are due to her weight. Of course. She tells us she's never been more active after having a kid. Her diet hasn't changed. Her work life hasn't changed. Nothing has changed. The weight gain just happened due to hormones. We ask if she's breastfeeding. She says yes. We ask how she's getting the extra calories for the breastfeeding, and she tells us the clinic told her to eat 1 to 2 bowls of plain oatmeal a day. It worked, so she's still doing it. We figure this is how she gained so much weight. She's probably eating 2 large bowls of oatmeal on top of her meals, with milk, sugar, butter, etc. But the woman insists she's eating 1 to 2 packets of plain oatmeal a day. Nothing on it, nothing added to it. It says plain on the package. It tastes plain. It's plain. We send the doctor in to see her after briefing him on the whole story about the oatmeal. He's in the room with her a long time, much longer than normal. When she comes out of the room, she keeps her head down and walks off, looking angry and embarrassed. The doctor walks up to the nursing table and fills out the chart. You never asked what brand of oatmeal she's eating. Yeah. Turns out she didn't know plain rolled oats were a thing. She thought the breastfeeding clinic meant plain oatmeal cookies. She was eating an entire package of dad's oatmeal cookies every single day for a year, basically a bowl or 2 filled with cookies, and could not understand how that was different from oatmeal. Nurse here recently had a patient's wife claim to be a retired nurse. While we were teaching her how to do an in and out catheter on her husband, she asked which hole the pee came out of and which hole the semen came out of. Dentist here. In school I had a 70 years old part who was still in the dating game and looked like that old lady who just died who played the genie. I was thinking of Joan Rivers. She's got a ton of acid erosion on her teeth. Tells me she drinks on Frio water. Didn't know what was in it. We look it up on Google. That'd be a pH of 3. All of her water. Plus, she likes to put lemons in her water. I tell her this is also acidic. She tells me I'm wrong because her friend who took a few nutrition classes said that as soon as the lemon juice gets into the body, it turns basic. I told her I had a biochemistry degree, and that was wrong. Also, her blood pressure is super high every visit. She tells me that she stopped taking her BP meds because she thought they were unhealthy. I tell her that the method is not working at all. A few weeks later, she strokes out and never gets out of a wheelchair again. I'm friends W her on Facebook now. It's just sad. I saw a man in his 30s who took cocotamol, paracetamol plus codeine to get his opiate fix. He had been doing so for 3 days. He presented in acute liver failure, horrendous pain, and died later that week. Please follow the instructions on paracetamol, acetaminophen for those over the pond. They're not sweets. I'm a medical student, but the number of patients I've seen who refuse to take medicine because they don't want chemicals inside them is staggering. Patient came in with a rash around her mouth. She was going on about how she had it 14 years ago, and the dermatologist prescribed a certain antibiotic to cure it, and diagnosed her with perioral dermatitis. She's showing us pictures on Google. Okay. Doctor diagnoses her with impetigo, and prescribes her an antibiotic ointment. She leaves and fills the prescription, and comes back flipping her sheet. She googled impetigo, and, with the help of WebMD, came to the conclusion that it was a children's disorder on the arms and legs that can only be contracted from children, and she wasn't around children. Insists that what she believes she has, perioral dermatitis, is a woman's disorder and she doesn't have this children's disease. Says that the antibiotic he prescribed isn't on the list of treatments. Thanks WebMD. It's on the top of the list actually, of actual medical books, but whatever. Whole time, she's showing us these pics off Google of perioral dermatitis saying it's a woman's disorder. Half the pictures were of them. Now one thing you should know, perioral dermatitis means rash around the mouth. That's it. It doesn't mean sheet. It's not a type of rash. It's not only cured by a specific antibiotic. It's just a rash that happens to be around the mouth. She was furious, shaking with rage and about to start throwing sheet. BC the doctor wouldn't prescribe her this certain antibiotic. Doctor told us to call the cops if she came back. People are crazy. I'm a postpartum nurse. This isn't so much weird as sad, but I've never forgotten it. I had a patient ask me, do you ever feel like everyone is watching you and judging you? I told her yes, I suppose everyone feels that way sometimes. Then she said, and when you feel that way, don't you just need a little cocaine? To which I answered no, while thinking if I did, would I tell you? Also, she kept fiddling with her plain fluid forth to make it run faster. I'm pretty sure she thought there was something in it. I had to put it on a pump. The people judging her were her parents, who had custody of her children because she was engaged to a man who molested one of them. After I found that out, I kind of judged her too. A lot of patients come to the hospital because they are sick but refuse to do any tests or take any medicine. Do people expect healthcare workers to do a ritual dance and chant around them and magically heal their illnesses? I got a phone call late at night through the answering service. This is somebody, a pharmacist at the Walgreens on D Street. Sorry to bother you, but a quick question. How do you spell 40? Me, half awake. 40. That's what I thought. We have a person filling a script for 40 pills. We'll take care of this. I write opioid prescriptions that last a day or so for patients unknown to me until they see their primary care physician. I work as a receptionist office assistant at a large clinic, so I'm obviously not a doctor, but I do deal with a lot of patients. I haven't been doing it for very long, but I have a couple interactions that come to mind. One was a lady wanting to know if our clinic would do a virginity test on her because her PCP told her they don't do that. It took me way too long to explain it's not a real thing. Another lady needed to get tested for STDs. Not weird, but she said she needed us to send the results to her prospective employer. Why? We told her we wouldn't do that, but she could come get a copy of her results and do whatever she wanted with it. She does, but comes back later the same day and says we gave her the wrong test results. We double check. Nope, those are definition her test results. Trying to sort this out with her, I asked her why her employers would want an STD test anyway. She said it's to make sure she doesn't have tubulars. Then it dawned on me. She meant tuberculosis. She needed a TB test, not an STD test. She gets angry and yells that we are just trying to trick her into taking more tests so we can charge her more. Then she stormed out. I don't have to deal with people patients, but I helped out a vet for a while, and there's a lot of dumb pet owners. Had one lady who was really concerned about her obese lab getting hiccups. The vet let her know the dog was overweight, and she told him he was wrong, and then insisted we do diagnostic tests to figure out the hiccups. I'm a student and my GP supervisor was involved in a scheme to reduce R&D waiting times by having a GP in R&D to take patients that weren't actually in an accident or an emergency. As none of the patients were actually dangerously ill, I was basically doing the consultations with the doctor, supervising, double checking and signing prescriptions, etc. A guy in his late 20s walks in, looking very healthy, and sits down. I was stung by a bee this morning. Okay, where? On my cheek. There's no swelling or anything visible. How long ago was this? Well, it took me about half an hour to get here, and then I've been waiting another 3.5 hours. I wonder why. Did it stop you swallowing or breathing? No. Are you allergic? No. UMM. What would you like us to do? Check I'm okay. At this point I turn around to my supervisor attempting to say WTF do I do here? He says you're okay, go home. It was the most surreal consultation I've ever had. Not stupid, actually kind of sad. My friend told me that she met a man on her oncology rotation who had lung cancer and who was convinced that some chlorophyll drink his wife was making him could help him photosynthesize, make oxygen and breathe better.